going to concentrate on the business development side and touch upon the scientific part as we go along. And then I have borrowed the title with adding a few words here and there from the program, and I'll try to stick to that. My talk is essentially two parts. First of it is general, and then the second part I'm giving, I have given a proposal to QSTP as establishing a company here in Doha, Qatar. And actually I'm using that as an example. It's a little self-serving and advertisement, but that's okay, I'll do that. Okay, the first two slides are actually a copy of the notes that I've written to myself as a reminder, and I do not mean to stress this too much upon you, but these are the notes that I make to myself, particularly coming here in countries like Qatar or being in the Gulf region. The first thing that I would like to remember is here we have to cover a lot of ground very quickly. We don't want to go back and then do a lot of basic research here, particularly to reinvent the wheel. And then we would like to do something that we can actually accomplish rather than hoping to accomplish. And more importantly, I do not wish to have a company here that is very local. I would like to think globally, because we would like to get it started here and expand globally, worldwide. And then we do have the worldwide patent protection to do that. And as such, we have actually chosen a university-accepted program that serves major unmet clinical needs. I'm borrowing a major from I think when it is erroneous that this is the way it should be, major, not necessarily unmet. And then we have actually thought of having a pipeline for growth, and as we say in the United States, have a plan B. Again, this is the second slide. These are again notes to myself. You don't have to take them very seriously. Thank you. And these are very can you hear me? Is that all right? Okay. They're very self-explanatory. I don't need to explain that. The important 2 points at the end to be persistent and resilient, because there are a lot of challenges, particularly out here, for having no little help from the campus-type atmosphere or the situation that we have, for instance, in Maryland. We have quite a few universities, 300 biotech companies that we can actually exchange with. And then the important thing that always remember, we have a goal, we will concentrate on that. Again, these are two notes to myself. Okay, I'm going to define real and lasting success. I believe that the final success is brought by individual private companies with commercializable technologies having regional and global utility. And if you have a company here, the company should be very, very independent in the sense of what it's going to do. And then if QSTP decides to invest in the company, we will get their help, but they're going to be helpful as an investor, as a local supporter. Therefore, it is very important the company to be responsible for its success or failure, God forbid. And then, of course, being here, Qatar Foundation, Qatar Science and Technology Park certainly can create a right environment, facilitate the progress. This is actually obvious, but I have to state that. And also, we have been trying to get in touch with, we have succeeded, in fact, to a certain point, to involve the Qatar Health Authority with what we're going to do, because it's medical and we can't avoid that. One thing that we have been talking about for the past couple of days is infrastructure, and then how important it is for the companies to survive here, and the workforce, of course. And I'm proposing some core programs. I call them cores. I'll explain it to you a basic element of infrastructure, major source of workforce. The course that has come to my mind, I'm sure people can add to the list, or some of them already exist here. The antibody development, production, and manufacturing core, and the chemical synthesis, process development, and manufacturing core, and the proteomic core and genomic, which I understand that the QSTP is trying to do that. Animal laboratory is quite important no matter what we do around here. And clinical support, as well as GMP, GLP, and CLIA laboratories core, because although all of these happen to be very trivial when we get to it, it's very, very important. Aside from having the infrastructure, if the company that is going to be situated here is a part of a larger or functioning company elsewhere, being Europe, Cuba, in this case, United States, it would probably, to some extent, take care of some of the challenges that would come up, and that's what we're proposing, that Panacea Pharmaceuticals in the United States would fill in some of these positions until and unless things are happening here, in fact, would help create these cores. As far as the organizational core go, those are again my ideas to myself. I'm not necessarily to dictate it to anyone else. I always think the core should be an independent entity but associated with academia. I don't know how your protocols core is. Probably it is that way. They should be adequately subsidized. It's very difficult to have a core in smaller market like this to be able to sustain itself. It has to be subsidized, at least initially. Should have very strong internship programs. The important internship part is that creates workforce for what is going on in this area. There should be always a charge to the companies by the core. There should be no free lunch, as the cliche goes in the United States. They should operate outside of government bureaucracy. I have avoided government bureaucracy all my life. Actually, I've been traveling all over to avoid it. But that's my preference. If it should be subsidized by the government, not a part of the government. All right, I'm going to give you the Panacea MENA. Panacea MENA being Middle East and Northern Africa, an example proposed to QSTP. Again, from here on, it's very self-serving and advertisement. I hope you understand it. By the way, this is the first time I'm going to have 10 minutes of undivided attention here. At least he's going to look at the screen. Okay, we're proposing to have 3 different functions here for a good reason. One, I have actually taken Dr. Zaroune's advice, the 4 Ps, and some of it you will see appears and disappears here. And then I would like to be able to have a company here that has short-term, mid-term, and long-term, and a very nice mix of things, and not necessarily one pony show. The first one is a cancer testing laboratories based on measuring serum HAH level. Panacea would give exclusive rights to MENA region to Panacea MENA. The second one is a cancer vaccine therapy. Is a dendritic cell-based. I'm going to go into that. I'm not going to get too much into the scientific terms here. But that is a procedure. It's actually midterm. We have developed the process, the GMP, GLP process in Panacea. And it's a procedure here. We do it in clinics in association with one of the local hospitals. And also the in vivo imaging that the Panacea is going to get worldwide rights to Panacea MENA. In effect, they pay for its development, and then this would expand worldwide. It's not just locally. That's what I'm saying, having different umbrella for